An open letter to leaders now and those who have come before. As we look to tomorrow, seeking for the best leader in sight, are we looking for someone bold or someone who gets things right? Are we looking for a leader who has a vision and a strategic mind? Or a leader who cares, ensuring no one gets left behind? In healthcare, we all have our own hard-earned degrees. We are here to care for patients and overcome every disease. It truly is a noble profession where we heal one life at a time, making sure each individual's health is at the prime. But there is a greater calling for each and every one of us, with all the challenges in healthcare that we have to discuss. Whatever country we are in or region we belong, we need leaders to help us overcome and help us get along. From accessibility to care, to working on health financing, from capitalizing on AI's potential to day-to-day innovating, from managing human resources and advancing equality, from learning to partnerships to promoting sustainability. In our ideal world where health is prioritized and available to all, that's when we need leaders to make the right calls. But again, what kind of leader do we actually need to make this true? Do we need someone traditional, tried and tested, or do we need someone new? Let me share my thoughts, and let's call it leader shift for now. It's taking into account what works from the past, including experiences and know-hows. It's about learning to innovate, adjust, and assess the situation at hand, not boxed in with preconceived notions or paralyzed with ideas so grand. Leadership lies in the leader's ability to balance experience and theory, being able to shift leadership style based on circumstance and accountability. We need a leader who can be firm and gets things done, but also has a heart, especially when morale is close to none. We need a leader who motivates people towards a common vision, but is also self-aware of strengths and imprecisions. We need a leader willing to improve and grow, who raises others with and keeps them in the know. We need a leader who is visible, transparent, and participative. A leader who sees us for our worth, encouraging us in our initiatives. We need a leader who can empower, but at the same time direct command, but also garners respect, being flexible and knowing when to take a stand. If we look back at why we entered healthcare, I believe we wanted to serve and watch out for people's welfare. Leadership allows us to adapt to every challenge we face, as we all aim to make this world a better place. But we must not forget to learn to connect, to be genuine, to be true, equipped with moral and ethical values, with a heart to serve. Leadership starts with me and you.
Joanne Conroy, President and CEO of Dartmouth Health. And thank you, Dr. Alonso, for such wonderful words. It gives you an indication about the session that you will be able to experience over the next 40 minutes. We have the opportunity to introduce you to 3 of our young executive leaders. They've actually each written a letter about the impact that they want to have in healthcare, and we've paired them with a seasoned leader who will ask them some questions about their statement and what they hope to achieve by investing in leadership. Rick Pollock, who is the CEO of the American Hospital Association, I'm the chairman of the board of that organization, often uses a quote about leadership. And it's from Peter Drucker, who many of you have appreciated as an American author on leadership. Management is knowing how to do things right. Leadership is knowing how to do the right thing. You will find a theme that goes through all of these letters and the conversations that strikes you with the authenticity as well as their commitment to something greater than themselves. We all know that healthcare globally is not perfect. There are a lot of things we do that don't work, maybe have never worked. And yet we're relying on a group of young leaders to show us the future. As seasoned leaders, we want to share with them our experience about what works, some of the breakthroughs we've had, but we also need to be able to unleash them so they can reinvent the healthcare system that we're going to need for the future. So joining us today are Mr. Federico Umberto Mion, who's head of finance and administration at Catania Hospital Authority, which is in Lugano, Switzerland. And he will be joined by Dr. Wang Young Lee, chairman and CEO of Myeonggi Hospital in Korea. Second, we have Esther Ajawi, who is branch manager of Avenue Healthcare in Kenya, and she'll be joined by Dr. Sidney Kleiner, president of the Brazilian Jewish Beneficent Society, Albert Einstein. And finally, it'll be my pleasure to have a conversation with Dr. Chloe First, who is medical lead acute and urgent care program at Royal Adelaide Hospital in Australia. We may go a little over our time. We're supposed to end at 10:40. But we want to make sure that you're able to experience these young leaders in the beginning of their career and the conversations they will have with their seasoned mentors. So first, I'm going to turn the microphone over to Dr. Mion and Dr. Lee. Dr. Mion.
Thank you, Joanne. Esteemed authorities, honored guests, esteemed colleagues, as the Chief Financial Officer at the Regional Hospital of Lugano, part of the Ente Ospedaliero Cantonale, I am at the forefront of financial strategy and management for a key public healthcare network in Switzerland. Our organization is navigating an exciting transformation, having embarked on a journey toward becoming a university-affiliated hospital with the establishment of a new faculty of medicine in Lugano. Amidst rising competition from the private sector and increasing cost pressures, my role is crucial in ensuring we maintain sufficient profitability to support and sustain our upcoming substantial investments. The healthcare sector today is grappling with a myriad of challenges that are complex, multifaceted, and constantly evolving. One of the foremost challenges in almost every country is the escalating cost of healthcare. Rising expenses related to advanced medical technologies, pharmaceuticals, and aging populations are straining budgets and resources. Hospitals and healthcare systems are under constant pressure to deliver high-quality care while controlling costs, necessitating innovative approaches to financial management and resource allocation. Another significant challenge is the shortage of healthcare professionals. The demand for healthcare services is outpacing the supply of qualified professionals. It is crucial to develop strategies for training, retaining, and supporting healthcare workers to ensure a sustainable workforce. The integration of technology in healthcare, while promising, presents its own set of challenges. Electronic health records, telemedicine, and AI-driven diagnostics offer tremendous potential, but also require substantial investment and training. There is a risk that technology can depersonalize care if not implemented thoughtfully. At the heart of these challenges lies the imperative to maintain a patient-centered approach. Patients today are more informed and have higher expectations for their care. They demand not only effective treatment, but also a compassionate, personalized experience. The future healthcare leader must embody a unique blend of qualities and competencies to navigate these challenges effectively. Future leaders need a strategic vision that balances innovation with practicality. They must be able to foresee trends, adapt to changes, and implement long-term strategies that address financial sustainability, workforce development, and technology integration. Leaders must be proficient in leveraging technological tools to enhance care delivery. This includes understanding the potential and limitations of technologies like AI, telemedicine, and electronic health records, and ensuring that they are used to support, not overshadow, the human aspects of care. Despite technological advancements, the human touch remains irreplaceable. Leaders must prioritize empathy and compassion, fostering a culture where patients are treated with dignity and respect. Understanding the emotional and psychological aspects of patient care is crucial for creating a supportive and healing environment. Effective communication and interpersonal skills are vital. Leaders must engage with diverse stakeholders, including patients, staff, policymakers, and the community. Building strong relationships and fostering collaborations are essential for achieving shared goals and improving healthcare outcomes. Initiatives like the Young Executive Leaders program and congresses such as the one we are attending are of utmost importance to deepen these topics, create awareness, and bring stakeholders together to work towards these goals. Thank you very much for your attention.
Good morning, everyone. My name is Wangjun Lee, Chairman of Myeongjae Hospital and Vice President of Korean Hospital Association. It is a big honor and pleasure to join in this insightful plenary session. As you know, today's theme is generational leadership shift. The challenges we face are becoming more and more complex with each generation. Therefore, leadership is no longer about just providing answers, but about asking the right questions and finding new solutions together. Federico already showed very clearly what is the major challenges facing the next generation of leaders and what merits are required to them. Overall, I agree with his opinion. So let me dive into the first challenge, hospital sustainability. One of the biggest challenges hospitals face today is sustainability. With rising healthcare costs and aging populations, running a hospital efficiently while staying financially stable is not an easy task for any hospital around the world. Especially as the bundle payment system becomes more widespread and government budgets are further constrained, medical services based on public budget face increasing financial pressure. In contrast, labor costs continue to rise, making it increasingly difficult to generate profits. So we need to cultivate another financial source. A promising solution to this is through public-private partnerships. In Korea, we are actively partnering with pharmaceutical and biotech companies through public-private partnerships to create new businesses. The revenue from these ventures is reinvested into advancing healthcare technology and supporting step development. If I show a standout example of this, there is Samsung Medical Center, which created Inus, a bioinformatics company specializing in precision medicine using genomic analysis and medical big data. Inus was successfully listed on Kosdaq market, showing how hospitals can secure long-term financial sustainability. In addition, we must continue to look for ways to create new economic benefits, both within the hospital and beyond the hospital, across various areas. The second challenge is one we are all familiar with: workforce shortages. Hospitals worldwide are struggling with this issue, and Korean hospitals are no exception. As you know, in recent times, South Korea has been experiencing significant conflict between the government and the medical community over the issue of increasing the number of doctors. Additionally, due to a shortage of nursing staff, the enrollment capacity of nursing schools has been significantly increased during the past decade. However, since many young nurses are leaving the medical field rather than staying, the increased numbers of nursing graduates has had only a minimal impact on the actual increase in professional staff. However, we've turned to AI-based diagnostic system and automation technologies to ease the burden on our medical staff and ensure the speed and accuracy of diagnosis and patient care. Especially, I would like to share the experience of how the implementation of voice ENR, the voice electronic nursing record, has greatly increased the efficiency of nursing tasks. Lastly, I want to emphasize the importance of adopting new technologies to promote better patient experience. However, any investment in digital transformation needs huge financial budget and investment. In that aspect, forming partnerships with digital healthcare platforms can help optimize hospital operations and improve patient experiences. By enhancing healthcare accessibility, these collaborations can reduce costs while maintaining high-quality care. Korean hospitals has made great progress by implementing smart hospital systems that enhance both operational efficiency and patient satisfaction. Technology is great, but it must serve the ultimate goal, the improving the patient experience. No matter how advanced technology becomes, the most important element is healthcare is still the human touch. At the end of the day, what patients remember most, it isn't the technology. It is the warm smile, empathy, and genuine care they receive. We never lose this insight. Let's go to the conclusion. Already, Federico pointed out 6 merits the next generation leaders should have. First, patient-centered philosophy. Second, leadership in competence and qualities. 3, innovative strategic vision. 4, insight of digital healthcare transformation. 5, human touch capability. 6, finally, the communication skill. In these turbulent times, the next generation of leaders will need even greater skills and talents to overcome the big challenges ahead. But if I had to pinpoint the single most important quality that ties together all 6 merits for the next generation of healthcare leaders, it is the balance between innovation and empathy. Yes, we must embrace new technologies to ensure sustainability and efficacy, but we must never forget that healthcare is ultimately about people. Leaders of tomorrow must be able to combine these 2 elements seamlessly. Additionally, I would like to express that Korea's hospitals are playing a significant role in global healthcare innovation. I believe our hospitals have the potential to continue contributing to the future of healthcare. At the end, I would express my gratitude and encouragement to Federico. Thank you so much. Obrigado.
Thank you, Dr. Lee. And Federico, you have a wonderful future as a head of a facility or a leader in finance, because you realize it's not just about the numbers, it's about the mission of the organization. And you're there to support your patients, your communities, and the colleagues that all serve them. So thank you very much, and thank you for committing your time to this training experience with the Young Executive Forum. So our next speakers is going to be Esther Ajawi, and then Sydney Kleiner will be responding to her letter. Take it away.
Thank you. I'm Esther Ajawi. I'm a proud participant of Yale 2024 cohort, and I currently serve as a healthcare professional from Nairobi, Kenya. I work in an institution known as Avenue Healthcare, where our mission is to provide high-quality healthcare services that exceeds our client expectations, aiming to bridge the gap in healthcare accessibility and affordability. So I'll mention some of the challenges that we're encountering in Kenya today, and some of these challenges include inadequate funding and resources. Many healthcare facilities are struggling with outdated equipment, insufficient medical supplies, and limited access to advanced technologies. This is hampering our ability to be able to provide cutting-edge treatments and diagnostic services. Other challenges we have, of course, is the shortage of healthcare professionals. The ratio of healthcare professionals to patients is quite low, leading to overworked staff, extended waiting times, exacerbated burnout amongst our healthcare professionals, and this negatively affects the quality of care that we're able to offer. We also have healthcare disparities in the country, where social economic factors affect the level of care that individuals are able to receive, with those individuals from lower social economic backgrounds experiencing greater barriers to accessing healthcare services. These disparities are more pronounced in the rural areas, where we find that healthcare infrastructure is quite less developed. As we look into the future, the leader of the future needs to encompass certain competencies and qualities to be able to navigate these challenges effectively. One of these qualities involves being a visionary thinker. The future leaders must be able to envision a transformed healthcare landscape, where they're able to leverage technology and innovation to improve patient care and operational efficiency. They should be able to implement telemedicine, electronic healthcare records, and other digital healthcare solutions. The leader should be adaptable. The healthcare environment of today is quite dynamic, with constant advancements in medical knowledge, technology, and regulatory frameworks. Leaders must be able to embrace change and encourage a culture of continuous learning and improvement, enabling them to respond effectively to these emerging challenges. The leader should also have empathy. Being in the healthcare industry, you're able to understand and address the needs and concerns and emotions of both patients and the healthcare staff is important, so that you can foster an environment of support and compassion. Leaders who prioritize empathy are able to build trust, rapport, that will lead to patient outcomes and enhanced team morale. The leader should also be committed to inclusivity. whereby you're able to reduce healthcare disparities by ensuring that the services are accessible and affordable for all. They should be able to promote diversity within their teams, recognizing the value of different perspectives in delivering comprehensive care. And finally, the leader should also have strong communication skills, which will ensure that the leader conveys complex information clearly and concisely to a diverse range of stakeholders. This includes our patients, our policymakers, our staff, and the broader community as a whole. Transparent and open communication will foster trust and collaboration. I believe by embodying these qualities, the future healthcare leaders will be well equipped to address the multifaceted challenges that are facing the sector today and drive meaningful improvements in patient care and outcomes. Thank you for listening.
Hello, everyone. Thank you. I'm going to thank the organization of this Congress for inviting me. My name is Sidney Kleiner. I am a practicing physician. I'm a surgeon, general surgeon, colorectal surgeon, and also I lead Albert Einstein Society, which is a big system in Brazil with 5 public hospitals that we manage and 2 private hospitals. And I will say some words about not the challenge that we have as a leaders in healthcare, because I think everyone that is here in a Congress, so important Congress and crowded like this one, everyone is looking for some solutions to healthcare problems as a complex environment that you live every day. So we are talking about leadership of the future, and one provocation, I want to provoke the discussion here. We are talking about the future of the leadership or the leadership of the present that we need. We are needing now this kind of leadership. So what we need, it's another way to leadership, but I don't think it's for the future, for the next generation. We as leaders, we act as an example. So we must take all that were spoken here by the youngest leaders that we have. Very, very proud of have you in the leaders of your institutions. But take the example and the challenges that they are facing to try to solve together as the leadership of the moment. We don't need any kind of old model of leadership with authority, with some obligations, but we need to be part of the team. We must lead by example. We must walk the talk. That's what I think. I cannot say that prevention is important and we must avoid bad habits, for example, for health prevention, and we indeed do the opposite in the hospital. I have the opportunity to work as a physician also and as a leader, and I cannot behave in different positions as a leader to my health team and also to my hospital. If I want the patient to have the best experience inside the hospital, I cannot treat very, very well my patient in front of the health professional that we have. So we know that healthcare is a complex environment, a complex system, not only in Brazil, but all over the world. And I love to hear what Esther showed to us. But I think to be a leader, we must have alignment of the purpose of the organization. We have in Einstein, for example, the purpose to deliver better health to every human being with a drop of Einstein, so that we are looking for some public-private partnerships. So we are looking for a scale with 36 units around the country in Brazil, even some consultancy in Latin America. But I cannot say in a consultancy what I'm not doing in my own organization. I cannot launch a management in other hospital without going there to see what problem that we need to deal with. And also, I cannot avoid recognizing the good work with my team, with my professionals, with my collaborators, creating, for example, celebration moments to be with them, to provoke, to say, for example, yesterday we had a celebration of 25 years of Joint Commission, and Einstein was the first one. We don't have the leaders of the future 25 years ago when they saw in the future the opportunity and they need to be a measure accreditation in healthcare, for example. So I agree that we have technology, but not technology by itself. We must invent technology, we must use technology, but to accomplish the purpose that we have in our institution. When I do so, we can stimulate the creativity of our team, even when it's proven in the end that it's wrong. Because if it's wrong, we can manage to be right and to deliver what we need in the purpose, not in the use of technology. So we have a lot of technology. We must be humble as a leader. We must recognize people, even that it's not our job, but the job of the team, always the teamwork. And as we heard yesterday in a presentation of Carlos Pellegrini, a chairman of the JCI, to lead not in the future, I think to lead in the past also, and to lead in the present, is more important that we lead with the heart and not in the brain. Because with the heart we are together with our team, showing good examples, trying new things that maybe is not important nowadays, but will be important next 10 years, for example. We have the example of telemedicine. When we launched in 2012 in Einstein, our laws forbid the use without doctors in the two parts and the 2 points of the conversation. But we launched to solve some kind of problems, to make visits in ICUs in other hospitals. And when the COVID pandemic came, we were ready to deal with telemedicine because of almost 10 years of a journey. That it's not so vigorous in the beginning, but it was very important in the future. It's not a mistake to start in the beginning, but we must look ahead of the moment. And this is not the leaders of the future, that's the leaders that we need now, or we needed a few years ago. So, what I think that the next generation of leaders will need curiosity, will need passion. As we have to have curiosity, we need to have passion, knowledge between what we have and what we can accomplish at the end of the day. We need knowledge. So, capability, knowledge, but nothing will lead us to the very good responses to the complex environment of the healthcare if you don't have passion, if we don't have alignment of purposes, if you don't have curiosity, open minds, and teamwork. Leadership for me is about teamwork. It's about to enable your team to work, to be engaged, not you have to do, but what we want to do together. That's my opinion. Thank you.
Well, thank you, Esther, and thank you, Dr. Kleiner. You know, it's interesting, you identified two very important things. You need to lead by capturing people's hearts, but also capturing their minds. And then, as a role model, actually removing the obstacles to change. And that is really the heart of what we're trying to teach our young leaders. It's not telling them what the solutions are, but training them how to lead in circumstances that are hard to predict for the future. But you know, everybody in the room has an opportunity, and we say this a lot in the United States, where I'm from, is that we're often the provider of healthcare, the employer, and the insurer. And we should be leading the change together as we role model and design how we care for ourselves and our communities. So now it's my pleasure to take off my moderator hat and become the seasoned reactor hat. And I want to turn it over to Dr. Chloe first to read her letter.
Dear Congress, I am not a poet nor a philosopher. I'm a scientist, a realist, a doctor, a young woman. I am passionate, vulnerable, optimistic, and compassionate, and I am an example of the changing face of health leadership. I feel gratitude and privileged that I am trusted to work in the Australian healthcare system and be an advocate and voice for future change and improvements in health. Leadership in the health space is fraught with complexity and requires bravery and a sense of curiosity. The healthcare leaders of today recognise that whilst we needed change yesterday, if you try to rush it, you will leave your team behind. And so, we must constantly walk a tightrope where we hopefully inch closer to meaningful change, but all the while must recognise the tightly held balance and tension between budgets, expectations, shifting opinions, and new ways of working, as we try to continually improve the complex system that is healthcare. Like all of you, I get up every day to fight the good battle and try to address the daily challenges the healthcare system presents me. Working in a quaternary public hospital in Australia, the main challenges affecting my organisation are people-based. But this is not isolated to my organisation or indeed my country, but is replicated around the world. We have an ageing population. People are living longer, and their knowledge about treatments and interventions that might increase their longevity is not paired with an understanding of the poor quality of life that often is experienced during the extra time afforded by these interventions. Society's increasing expectation for provision of expensive treatment has again not been matched with the increased resources required to provide this care. And unfortunately in Australia, this is compounded by a struggling and poorly remunerated primary health system. Despite the realisation that investment in preventative health leads to long-term benefits, it is difficult for the policymakers to have the discipline to play the long game and properly invest in a future while still adequately funding and managing today's healthcare needs. The scarcest resource in health in Australia is the clinician workforce, with high vacancy levels across all members of the multidisciplinary team. Following COVID, many healthcare professionals re-evaluated how they wished to work, with a rise in the part-time workforce and many leaving the profession completely. As such, even when we have new ideas and exciting innovative models of care with appropriate funding, we are limited in our implementation due to a lack of skilled workforce. Put simply, we don't have enough healthcare workers to go around, and the workforce we have retained have high rates of disillusionment and burnout. So one of the greatest challenges for the leaders of today is how we motivate and empower our clinicians and the leaders of tomorrow to help rebuild the industry and attract skilled staff back into the profession. We must ensure our staff truly know how valued they are. The provision of ethical healthcare is an increasingly important consideration for the healthcare leaders of today. Unfortunately, the gap in health outcomes between Australia's Indigenous and non-Indigenous populations, as well as across other socio-economic groups, is large. The fact that Australia's First Nations people have a life expectancy 10 years less than their non-Indigenous counterparts sheds light on the inequity that can no longer be ignored. With all the challenges in our health system, we need strong, resilient, and empathetic leaders, now more than ever. I hope to continue to be the leader my team needs me to be. Thank you.
So Chloe, your messages about provider burnout, I'm sure are striking a chord for everybody in the room. I think that's a global challenge, not one particular country. If we could make one intervention, because we can't create more providers, many of the countries in this room have aging populations and fewer people to provide care for patients that you care for every single day. What would be the one message you would want people to bring back from this session to their medical staff, their professional staff in their organization to make them feel like there's a future that they actually can get their arms around and advance?
I don't think we have one message to reduce burnout. However, I think what we as leaders have to do is reduce the barriers to providing care for our frontline clinicians. No one went into medicine or nursing or allied health we went into it because we want to care and truly improve the life and health of the patient in front of us. So how do we give clinicians back that space to do that? How do we let them work to the scope of their practice? We need to get rid of the pebbles in the shoes. I think, burnout, we know that the EMRs are one of the biggest contributing factors to burnout. There's sort of click fatigue. So we need to sort of take away all those barriers that take away the time from actually spending with patients to give the clinicians time back to work with their patients in front of them.
You do highlight something that countries that have a lot of technology have realized is contributing to more burnout. We call it pajama time, the time when our providers are completing their charts at home after they put their families to bed. And it's something that our technology has created for us, and we have to figure out the way out of that maze. Talk a little bit about health equity, though, because I think that's another topic that a lot of us struggle with, and you see it very starkly in your practice.
Yeah, in Australia, as I mentioned, the health inequity is huge. We have really invested in Indigenous populations now. I recognise, and I think we all recognise it's too late, but at least we've started that conversation and we've started that investment. So in Australia, if this was a Congress, we would be recognising the lands of the Indigenous people on which we're meeting. So I come from the lands of the Kaurna people, or the big red kangaroo. And I think it's about reinforcing that message, and that these cultures existed sort of far before our time, and starting to integrate it into the conversation, reminding everyone that this is hugely important. We also now work on the provision that nothing about us without us. So we truly have integrated Indigenous culture and Indigenous voices into all the decision making, and I think that's hugely important. We're actively measuring KPIs around our Indigenous populations. So, for the emergency department, it's that we separate out Indigenous patients that leave without being seen, so that we can really try and address some of these health inequalities. And this goes hand in hand with obviously the huge financial investment, because talking about it's one thing, but we need to actually invest and put the money there to make up for the years and years of inequity.
Yeah. Well, thank you so much for everything you do. And thank you, Esther. Thank you, Federico. We appreciate the time that you've spent over the last year participating in the Young Executive Forum. And I want to thank the audience for your attention. And our panel members will be around for the rest of the day if you choose to ask any of them any additional questions about their experience as young leaders, and perhaps all of you will nominate people from your organizations to attend in the future. So again, a big round of applause for our panel.